Hi, my name is Samantha Medeiros. I'm going to be your family nurse practitioner student for today. Can you tell me your name and date of birth?
It was Nick Wolf. My date of birth is 09/02/2000.
Okay, I'm going to wash my hands. And do you have any allergies I should know of?
Penicillin.
Any allergies to latex?
No.
Okay. And what brings you in today?
Just a checkup.
Okay. And can you tell me where you are?
I'm at the doctor's office.
And can you tell me today's date?
March 5th, 2024.
Okay, so first, I'm just going to explain to you, we're going to be doing a general assessment from GI to musculoskeletal. And is it okay if I touch you?
Yes.
Okay. First, just starting with your general appearance, your skin is appropriate, even in tone. You have, you're dressed appropriately for the weather and the, for your age. You're able to answer and complete sentences, and you're alert and oriented ×3. And then I'm going to start your GI assessment first. So I'm going to have you lie back. Okay, put your feet up. Okay. Just going to face the camera. So I'm just going to ask you to lift your shirt a little bit for me, just to take a look. So first I'm just looking at that both sides are symmetrical, skin is appropriate, even in tone, hair distribution is symmetrical, there's no distension, the stomach is flat, there's no signs of peristalsis. Okay, then I'm going to go ahead and auscultate in all 4 quadrants. And all 4 quadrants are normal active. Then I'm also going to go ahead and auscultate using the bell, this time for lower pitch sounds. The abdominal aortic artery, the renal arteries, the iliac arteries, and the femoral arteries. And no Broe can be heard, which is a normal finding. Then I'm going to go ahead and percuss in all 4 quadrants. And tympany can be heard in all 4 quadrants. This is a normal finding. Then I'm going to go ahead and percuss the liver. I'm going to go on this side. Starting from the bottom, listening for a change in sound, like dullness. You keep your finger right here. And then I'm going to start from the top. So about this distance is about 6 centimeters. That's normal size for a liver. Then I'm going to go ahead and percuss the spleen. And you can hear tympany. This is normal because if you heard dullness, it would be a sign of splenomegaly or enlarged spleen. Okay, then I'm going to go ahead and do a soft palpation. So I'm just feeling for any lumps or masses. Do you have any pain?
Nope.
Okay, I didn't feel anything. Now I'm going to go ahead and do a deeper palpation with both fingers. Again, feeling for any lumps. Do you have any pain?
No.
Okay. Then I'm going to go ahead and try to palpate the liver border. So just take deep breaths in and out. I'm going to put my hands below the intercostals. You can slightly feel it and it is smooth. Then I'm going to go ahead and try to palpate the spleen. So again, deep breaths. And it is non-palpable. This is a normal finding. Then I'm going to go ahead and do the kidneys. So what I'm going to do is put my right hand on top here and my lower hand underneath. And with my lower hand, I'm going to go up, and with my top hand, I'm going to go down. And the kidneys are non-palpable. Sometimes you will feel the lower lobe, but in this case, they're non-palpable, which is a normal finding. I'm going to do the same here. and again, non-palpable. Then I'm also going to palpate the aortic abdominal artery. So I'm going to go ahead and take 2 fingers, go right underneath here, right like about 2 fingers. Are you hungry? About 2 finger breadths above the umbilicus. And I'm just feeling for a pulse. And it's regular and rate and rhythm, 2+. And if I wanted to see the size, I would just do 2 fingers, moving them out slightly until I can't feel it, and then going back and doing the same with the other. And it should be about 2 finger breadths apart. If it's any larger, you would worry AAA. Okay. All right. Then I'm going to go ahead. You can put your shirt back down. I'm going to go ahead and get started with the upper section of your arms. So we're going to sit you back up. And I can move this for you. Okay, so I'm just going to take a look starting at your hands first, looking for any nodules, any redness, any inflammation of the joints, symmetry of the joints. And I'm going to feel the joint, palpate them. Do you have any pain when I palpate?
No, ma'am.
The proximal and distal interphalangeal joints, as well as the metacarpal and the carpal. Okay, can you squeeze my hands? Just testing for strength. 2+ bilaterally, and then I'm gonna have you do some range of motion. So stretch out your fingers, curl your fingers. That's flexion and extension, and then I'm gonna have you extend your wrist, flex your wrist, okay? Then abduct, and then abduct inward, okay? And I can also do these passively as well. All right, and then there's also some tests I could do for carpal tunnel syndrome. I can dorsiflex the hand and go like this. Do you have any pain?
No, ma'am.
This is the tunnel. No pain?
No, ma'am.
And then you can also go like this, and normally I would ask you to hold it for about a minute, and I would ask if you have any tingling or numbness in your hands. Do you have any?
No, ma'am.
No? Okay. And if you did, it would be a sign of carpal tunnel syndrome. Okay. All right. Then I'm going to go ahead and move up to the elbows. I'm just feeling the olecranon and the medial and lateral epicondyles. And if there was inflammation of the medial epicondyles, it would be a sign of like golfer's elbow. And if you had inflammation of the lateral epicondyles, it would be a sign of like tennis elbow. No inflammation there, so then I'm going to ask you to extend and flex your elbows. Okay, great. And then I'm going to move up to your shoulders again, and you're looking at your clavicle, your shoulders, your scapula, looking for symmetry on both sides, any lumps, nodules, any redness, inflammation, joint symmetry. Again, I didn't see anything. And then I can start at the sternal notch, move my way up the clavicular line to the acromion-clavicular joint there, and feeling the bicep groove here. Any pain when I palpate? No? Okay, great. Then I'm going to have you stand up, and we're going to do some shoulder range of motion. So I'm just going to ask you to put your hands like this and go all the way up and abduct your arms out all the way up as far as you can. Okay, great. And can you turn around so I can see you do it from the back? Again, perfect. And then you can turn towards me. And then I'm going to ask you to forward flex your arms forward as far as you can, all the way up and down, normal, and then extend your arms back. And I'm just looking to see that the spine isn't overcompensating at all for this movement, which it is not. It's perfect. Then I'm going to ask you to do lateral, you could relax. And then I'm going to ask you to do lateral rotation, so you're going to go like this and just, yep, without abducting your arms as much as possible. So try to stick your elbows to your body. Yep, perfect. And then I'm going to ask you with the back of your hand to reach at your back as far up as you can. Perfect. And it should be around T5 to T10, and then with the other hand as well. Perfect. Okay. You could take and then I'm going to ask you to move your neck side to side, up and down, all the way around. Perfect. And I could also do these against resistance, so like turn towards resistance, and that would be testing just the strength. and try and raise your arms with resistance. Okay, perfect. So strength is 2+ bilaterally. You can take a seat. Next, I'm gonna go ahead and test some of your reflexes. Okay. I'm gonna start with the top. So first we're gonna do the bicep reflex. So I'm gonna have your hand like this, and then I'm gonna put my finger over the bicep tendon. And you're just gonna watch for flexion as well on this side. Just relax your hand this way, but remember the elbow bended. Perfect. And then the brachial radial. These are both testing for C5 and C6. Okay, and on this side. Okay, perfect. Then I'm gonna do the tricep reflex. So I'm just gonna have your hand, you can relax, like dead weight, perfect. And I'm gonna go over the tendon. No, you can relax.
Yeah.
Okay, perfect. So you're just gonna have normal extension there, and this arm as well. You can relax your arm. Okay, perfect. Then I'm gonna go ahead and check your pulses first. Your radial. They're 2+, regular and right in rhythm, and your brachial. 2+, regular, right in rhythm. I'm also gonna take a look at your spine. I'm looking at your posture, that you're seated, you can set up well on your own without help. And then I'm also gonna palpate the columns. Any pain?
No, ma'am.
And the paraspinal muscles as well. Any pain?
No, ma'am.
Okay, perfect. Then I'm also gonna palpate your hips. Any pain when I palpate your hips?
No, ma'am.
Okay, perfect. All right, then I'm gonna go ahead and do the lower extremity. So I'm taking a look at your feet. Again, palpating the metatarsals and the tarsals. Also palpating the pedal pulse, which is right here. On both sides, comparing, they're 2+, and the posterior tibial. These are also 2+, regular, rate, and rhythm. And then I'm gonna ask you to push up against resistance, push down against resistance, go turn your ankles all around, perfect. Okay, and then I'm gonna do your reflexes of the lower extremities. And skin obviously is appropriate, even tone, no lesions, no nodules, no joints are symmetrical, no inflammation, no redness or swelling. So this is the patellar reflex, and this measures extension, and that would be L3 and L4. And then the Achilles, so I'm going to dorsiflex the foot, and then I'm going to just feel for extension there, and like a jerking in towards the plantar surface, and that's for S1 and S2. And then what I could also do if I felt like something was wrong, I could do the Babinski reflex or the plantar reflex, where I'm just scraping the outer, the lateral aspect of the foot. And normal sign would be that the toes flex downwards. In a baby or a newborn up to 2 years, they can extend, and that would be normal in a baby, but in an adult, it could be a sign of a UMN lesion. Okay. So then I'm just gonna have you turn your knees outwards, like turn them like this, abduct them, abduct outwards and abduct inwards, flex them, extend them up all the way. Yep, perfect. And I could do these passively as well if I wanted to. And then against resistance. Perfect. Okay. All right. Then I'm gonna go ahead and move into the neuromusculoskeletal. So I'm gonna do what's called RAM. These are rapid alternating movements. You're gonna go one like this with your fingers for me and do it like 10 times fast. Okay. And then another one you could do is like rest your hands here and just go with this quickly. Perfect. And then with your feet, tap my hands quickly. And this is just testing that your cerebellar function is intact. Another one we could do is heel to shin test. So you're gonna put the heel of one and move it all the way up and all the way down. Okay, and I'm just looking that the movement is smooth and there's no jerky movements, no inability to keep your heel on the shin. And this is also testing cerebellar function. Then I'm gonna go ahead and I'm gonna test your exteroceptive sensation, and this is gonna test between sharp and dull. So this is gonna be dull, this is gonna be sharp. You're gonna tell me if you feel dull or sharp.
Dull.
Okay, so close your eyes.
Sharp. Dull. Dull. Sharp. 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 Dull. 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 Dull.
Okay, perfect. Then I'm also gonna go ahead and test your temperature sensation. So this is gonna be cold and my hand will be warm, okay? So close your eyes.
Cold. Cold. Hot. Hot. Cold. Warm. Cold. Warm.
Okay, perfect. Then I'm going to test your proprioception. This is like your sensation of where you are in space and in movement. So you're gonna close your eyes. I'm gonna move your finger either up or down.
Got it.
Okay, and you're gonna tell me whether it's up or whether it's down.
Got it. Up. Down.
Okay, I'm gonna try this down.
Down. Up.
Okay, and then I'm also gonna move your arm and you're gonna tell me in which direction did I move it. If I moved in 2 directions or 1 direction.
2 directions.
Where did I move it?
You moved it right and then left.
Perfect. And where is it now?
It's left.
Like, where is it in space?
In space, it's right in front of me.
Right in front of you. Perfect. Okay. Next, I'm going to test your cortical sensations, which includes stereognosis, which is the ability to know what's in your hand without knowing what it is, like regular objects. And then, first let me explain. And then I'm gonna test your graph sensation, where I'm gonna like write something in your hand and you're gonna tell me what it is. So let's start with stereognosis. So you're gonna close your hand and you're gonna tell me what this is, that this item is.
It's a paperclip.
Okay? Close your eyes.
Oh.
You can
Coin.
feel it. Okay. And
It's a paperclip.
perfect. And then this one.
That is a coin.
Perfect. Okay. Okay, and then I'm going to do the graphesthesia. So you're going to close your eyes. I'm going to write something in your hand, and you're going to tell me what letter or number I'm writing in your hand.
Got it. 8.
Okay? I can do that one again.
Yeah, please. M.
Mm-hmm.
O.
Perfect. Let me see this hand.
8. S.
Mm-hmm.
N.
Perfect. Okay. And then I'm also going to do 2-point discrimination. So this is, I'm either going to poke you with 1 or with 2, and you're going to tell me whether it's 1 or 2 points.
How do you want my hands?
Okay.
Sit down. Okay. Sorry.
It's okay.
1. 2.
Let me see this.
1. 2. 2. 1.
Perfect. Okay. Then I'm just going to watch you do a couple movements. So can you walk normally in a straight line heel to toe for me? Perfect. And then can you walk that way on your tippy toes? And just looking at your coordination, your balance. And then walk this way on your heels. Okay, perfect. Then I'm going to do what's known as the Romberg test.
Am I sitting?
No, you can stand, please. I'm going to ask you to put your hands out like this and put your feet together. Hands out like this and close your eyes. And I'm just going to test to see whether you lose your balance or not. Okay, and you didn't lose your balance. This is a normal sign. And then also I'm going to ask you to sit down. You can take a seat. And I'm going to ask you to go like this and close your eyes, and you're going to try to keep these level. Okay, and the hands don't move. This is a normal finding. If they did, it would be known as like a pronator drift, and that would mean there's like a loss of balance on one side or the other. Okay, and that's all for today. Do you have any questions?
No, ma'am.
Okay, thank you so much.